engineering conversation and innovation. This is Schulich Connects, proudly sponsored by TD Insurance.
I am very pleased that you're all able to join us here and online to learn more about engineering technology for disease prevention and detection. This event is proudly sponsored by TD Insurance. If you've attended a Schulich Connects previously, you likely noticed that we have some new branding, which is connected to our recently launched updated strategic plan. Exploring connection and acknowledging where we are, I'd like to start by saying that the University of Calgary both acknowledges and pays tribute to the traditional territories of the people of the Treaty 7 region, which include the Blackfoot Confederacy, comprising of the Siksika, the Piikani, and the Kainai First Nations, the Tsuut'ina Nation, and the Stoney Nakoda, including the Chiniki, Bearspaw, and Goodstoney First Nation. The City of Calgary is also home to Métis Nation of Alberta Region 3. So moving to our formal program, advancements in biomedical engineering, which have made and will continue to make so many positive differences in our lives, in the lives of our family and loved ones. Our panel will discuss biomedical engineering achievements that have made as a society, changing our society, and how these technologies will not only allow us to live longer, but allow us to live healthier lives. At the Schulich School of Engineering, most will have heard or know that we relatively recently started a full undergraduate program in biomedical engineering. Last year, we successfully launched our Department of Biomedical Engineering, and as we speak, thanks to a generous philanthropic gift from the community, we are undergoing major renovations in our CCIT building to build what I think will be one of the best, if not the best, teaching and research spaces in the country for biomedical engineering. So before I pass it on to our speakers and our panel, some logistics. For our in-person guests, hold your questions until later in the event, and we will have a mic that can come around to hear your questions to put the panelists on the hot seat. For our virtual guests, please email your questions to ssemc@ucalgary.ca, and one of our team here will read off those questions as they come in. I'd now like to take a moment to introduce you to our moderator, Dr. Mike Callis. I've heard Dr. Mike, I've heard Mike, I've heard hey you. Mike is now the head of our Department of Biomedical Engineering here in the Schulich School of Engineering. He is a long-time, passionate, excited, energetic leader for biomedical engineering in a really true definition of biomedical engineering, thinking that it's not in one department or one faculty or even one university. It's something that is truly interdisciplinary, and success happens when so many people from different backgrounds and different perspectives come together. And I think that mindset is truly what has launched and is going to make our Department of Biomedical Engineering so great in terms of the impact that it has on our students and the impact the research will have in the community. So in addition to being a professor in the Schulich School of Engineering, Mike is also an adjunct professor in the Department of Cell Biology and Anatomy in the Cummings School of Medicine, and is a member of the McCaig Institute for Bone and Joint Health. Mike, I'll leave it to you to introduce the panelists now.
Thank you very much, Bill. Can you hear me now with this thing? Perfect. And thanks for reading all the nice things I wrote about myself. No, that was a very nice introduction, Bill. So as Bill mentioned, there's a lot of exciting things happening in biomedical engineering here. I'm just going to tell you about a couple other things. So he mentioned that we started our bachelor's degree, so we will have our first graduating class this year. So in April or June, they'll be convocating our first biomedical engineering undergrads. we have our largest student cohort of master's and PhD students. We have 194 students in the program right now. And we're also part of a couple of really large research initiatives. So one is called One Child, Every Child, and it is a campus-wide initiative to improve children's and maternal health. And there's a very large technology biomedical engineering component that will be a great resource for researchers here and will provide a lot of impact to the rest of the university. We're also just got some funding from the provincial government for something we're calling A-Medico, the Alberta Medical Device Innovation Consortium. So this is a province-wide initiative to bring together industry, academia, and the community around medical devices. And we're targeting underserved populations where we believe there's an unmet need in terms of medical technologies. So rural and remote communities, Indigenous communities, children, and the elderly. So this is really just launching, so stay tuned for some more. And broadly, we're just really excited to have a home now in those renovations, great undergrad and graduate populations, and hiring more faculty as well. So lots of cool things happening. But I think that's enough about me and BME. I'm going to introduce the panel, and my notes are in a different order than they're speaking, so we'll have to find the people. Hopefully I got the right order. So first, at the far end is Dr. Amir Sanadi Nazad. He's an associate professor in biomedical engineering as well as mechanical and manufacturing engineering. And his research focuses on bio-inspired microfluidics, tissue engineering, and biosensors. He's received numerous awards, including holding a Tier 2 Canada Research Chair in bio-micro-electromechanical systems. That's a mouthful for 8 a.m. Welcome, Amir. I don't know, Amir, if you have a minute intro you'd like to give, or yeah.
Me or okay. So Amir Nijad, as mentioned, we're developing different diagnostic and prognostic technology platform and recently wearable. The objective is just to really hand over these devices to remote and rural setting and potentially can be eventually use them in home setting for different applications. So it's more like a sample to result test kit technology platform. Yeah, sorry, I'm just associate professor of Department of Biomedical Engineering as well at the UFC.
Perfect, thank you, Amir. Next we have Daniela Robu, and who's right next to me here. She's the Director of Innovation and Business Intelligence at Alberta Health Services. She's a certified health executive and holds a Master of Science in Biomedical Engineering from the University of Calgary, an alumni, awesome. Over 22 years of experience in the healthcare industry and has presented at various national and international conferences. So welcome, Daniela. If you want to do a quick intro.
Thank you. So definitely proud to be a UFC graduate. So in the 22 years in healthcare, I have really applied a lot of the biomedical technology components, but aligned with the business needs from clinical perspective. It's a very complex environment, so you need to really use a lot of knowledge from performance technology, adult learning, so that you prepare people also for the change and also the system. So definitely set up multiple programs and led very complex projects. Thank you.
Awesome, thank you. Glad you could join us today. And last but not least, we have Jeff Rutledge, who's the VP of Digital Strategy at Gene Biomedical. He's a seasoned technology executive with background in entrepreneurship and business strategy, and his experience extends beyond entrepreneurship and includes roles at industry giants like Google and Oracle. For more than 3 decades, he's leveraged his unique blend of technical expertise, business acumen, and leadership skills to create value for stakeholders in a variety of industries. So welcome, Jeff, and maybe give a little bit more of an intro to the company.
Thank you, Mike. Unlike Michael, I actually did write all of that, so thanks. Great to be here this morning. My name's Jeff. I work for Gene Biomedical. We're a biomanufacturing company based out of Vancouver, but we have tighter and tighter relationships now with Calgary, the University of Calgary, and the City of Calgary, where we are planning on building a world-class pilot manufacturing facility for biomanufacturing, where students and entrepreneurs can get their hands on real-world manufacturing equipment to help bring products and services to the markets. So Gene Biomedical has been in this space for a few years now, kind of getting born out of the COVID era, but now looking more broadly at diagnostics for multiple purposes. So my role there is really just to help with the business and digital strategy, but my role on the panel here is just to bring sort of that entrepreneurial mindset. I don't have a deep background in bioengineering. I did spend a year at Google Health, but other than that, my experience is more entrepreneurial and starting businesses, taking ideas from the napkin to the market.
Awesome. Thank you, Jeff, and welcome here. So we're going to have a few questions that I'm going to ask the panel to get us started, and then we'll have questions from the audience. So maybe I'll start with the first one. Can you speak to some of the recent technologies that have helped advanced healthcare system? I don't know who wants to take it first. Danielle, you're right next to me. Sure.
It's an order here.
Yeah.
So I would list from CADF, the Canadian Agency of Drug and Technology. They set up in a report that they released last year, the trends for the next 5 years for the top 10 trends from biomedical technology and technologies in Canada. So they are remote diagnostic, care monitoring as one. The other one is point-of-care testing, molecular and genomic testing, health apps and wearables, voice technology, companion diagnostic, artificial intelligence for diagnostic and public health, artificial intelligence for health professionals. And there are some specifics that they listed for Canada, one related to diabetes, advanced closed loop pump, and also portable dialysis. So those are listed as top 10, and the strategies around that are building the different innovation strategies around the country.
Awesome. I think we're working on most of those here, so that's a good sign. Jeff?
Sure. So I have like I said, I'm not a deep biomanufacturing or biotech industry person, but I am a tech person. I experienced a revolution over the last 15 years in the technology space around software development and the way that the software development industry has transformed itself to to vastly change the ability of its abilities to create value and at a lower rate of defect. In the old days, software was a pretty rough industry, but in about 15 years ago, it began to introspect and kind of collectively in a distributed way began to introspect and think about how it was not living up to its constituents' needs. And there was a bunch of preconditions for that revolution. Then they all began to speak to each other. All these practitioners. It was very much of a practitioner-led revolution, and they began to speak to each other and create new practices and new tools and new culture around the process of software development. And I feel like in the medical industry, we're at a point where a lot of the same preconditions now exist for a revolution in the way that healthcare is delivered. And so that what I like to sort of think about is how to engender the ability of the industry to introspect on itself and think about new ways to kind of bridge this gap between the capabilities of the healthcare industry and the needs of the constituents it serves, and really transform itself. We're at this similar inflection point that I felt 15 years ago in the tech industry, where there's a bunch of new technology that is available, things like AI and cloud computing and all the amazing research that folks like Amir and the entire aggregation of research and development organizations. And so at Gene Biomedical, I mean, our goal is to try and facilitate that and enable the intellectual property to be developed and the value of that to be extracted in Canada rather than having it escape into other companies in other countries. So that's what I see as the kind of the where we are is at the precipice of another opportunity for a transformation in an industry, and I think it's the entrepreneurs and the R&D folks who can really drive the ability for this establishing of the ability for the healthcare system as a whole to serve its constituents at sort of a much higher level of, if you like, productivity or the ability to deliver all the services needed without tremendously affecting the cost of that. So doing a lot more with less. So I think that's kind of where we're at from a
Thanks, Jeff. Amir?
Yeah, so as a technology innovator, we are always get excited by new invention coming through. So in addition to what Daniela mentioned, based on the needs, as also Jeff mentioned, the needs is the one actually driving technology to be developed over the years. And then we have seen more of the wearable devices that provide access to example like sweat and saliva and the tears that are easily accessible in the body. You don't need to take a sample directly. There are a lot of wearable devices coming to be detecting some molecule within those. And some of this technology within the last 5 years has been translated to more implantable version or basically ingestible capsule that you can really just take a capsule and then they can monitor the GI health, detecting colon cancer and some of these advanced ones. But majority of these emerging technologies are in the development stage, and almost all of them is actually initiated by the needs in the community. So the needs need to be clearly defined, and then the engineers come to play to develop something. So far has been mostly, like in other way, we are as engineers develop as much as complex system that we want to develop, but then at the end of the day it's not translated because that's not exactly aligned with the needs. So I guess that has already changed last couple of years, that we have more communication with clinician, and then we got impressed of what is actually clinician need or clinical needs, and that is actually driving more and more wearable devices and implantable and so on.
Awesome, and that kind of leads into the next question I was going to ask, so maybe Amir can start the next one. We were talking about point-of-care devices and wearables and those kind of things for overall health or disease or even maternal children health. What has really changed in the public's eye so that allowing these technologies to become more commonplace, more research? So we mentioned kind of technical needs, we mentioned clinicians, but what has changed with the public? Amir, do you want to start?
From me? Okay,
yeah,
sure. So, public eyes has seen the changes particularly in the COVID time, when we have seen the technologies significantly impacting society. They can actually have a better diagnostic system come to play. They can better isolate people, less mortality coming from that. But in addition, access to more data analytics and result of the outcome from this diagnostic technology platform, or even other therapeutics, that give impression that actually people are getting more adapt themselves to be using them. But better accessible for this technology, as well as less costs, enabling to us basically to give the devices to people. And they are getting more adapted. We have seen like smartwatches and most of these fitness trackers. People are getting used to that. They can manage their own health condition. But they are more indirect measurement of the disease. We need more and more advanced technology to be directly measuring by biomolecule and some of the biomarkers that are specifically for those kind of disease condition. But in addition to that, there are a lot of different technology coming through. And then we do see more connection between different platforms. So all different companies, they have their own software, dashboard, and so on. So we have seen people are figuring out how to connect different platforms together to manage different aspects of health. These are the ones they do see, people see the changes in the public, and that's actually excite them to use them. Particularly technology is more adapted for elderlies and for people in like age situation. And then that is exactly what people get excited, how to use this more technology to manage their own health. And definitely more and more on the disease side as well, right? A better way of managing, personalizing therapy, having less effect from side effect of chemotherapy and so on. It's because these technologies are managing the disease, monitoring the chronic health condition, and these are really what people see, the advances coming from technology.
Jeff or Daniela?
Yeah, I echo Amir's comments that I think one thing that COVID taught us is that we all know how to put a Q-tip in our nose now, and I think sort of having that ownership of managing potential health awareness and potential disease, and me having an at-home test to be able to understand if I have COVID or not. I think that's just the beginning. I think that the population now, all of us in aggregate, are much more aware and accepting of having certain kinds of tests in our cupboard so that we can protect ourselves and protect our communities. And I think that it also kind of opened the eyes of the health regulation as well, where there is this need, at least at a population level, to monitor these sorts of diseases. And we went from having COVID tests being, you had to go to a specific place to get yourself a COVID test, to everyone having a COVID test in their cupboard. I think that was a real, shift on the regulatory side, allowing those tests to be used by public and trusting some of the results actually in terms of self-reporting. To monitor and control a population. So I think that this idea of using sort of low-cost, at-home diagnostic tools is a trend that was enabled by COVID, and I think it's got a lot of opportunity to have an impact on the productivity of the healthcare system. If we can do diagnostics closer to the point of care, sometimes back into the home, but certainly at the point of care, I think there's an opportunity to diminish the weight on the healthcare system as a whole.
Daniela?
So I'll have to summarize now everything. So definitely from patient perspective, because we look at the public, so the circumstance really is what changed. The COVID really shifted everything. It brought self-testing, flexibility in how to do that, a new teaching for the public. It's simple and convenient to do that. In addition to all the pro components, also looked at from health system perspective to be sure that we have no errors in interpreting those results, because there might be some errors from self-testing, and we don't want to be sure we draw the final conclusions for diagnosis and treatment considering that. So it's always looking at pros and cons so that we can manage the risks.
Yeah, and I think the public also sees COVID tests, but has to understand limitations of things like that, and where they could be not 100% effective, right? Awesome. So what do you think, if you had to pick one, I've heard a lot of different technologies mentioned. If you had to pick one, what do you think the biggest health-related technology breakthrough has been, say, in the last 5-10 years? I don't know who wants to start with that one.
Can I pick two?
You can pick two. All right, you can pick two.
So I think they're both important. The one related to artificial intelligence, both for health professionals and diagnostic, and the molecular and genomic component, because that's what can help with the prevention of diseases so that we don't clog the system, and also more efficiencies in the system.
That's three, I think.
No, I said the pros.
Oh, okay. Jeff?
Again, being an outsider to the medical industry, one thing I did observe was the acceptance of mRNA as a tool for diagnostics, and well, actually more so for vaccines. It came from a history of sort of a storied history, became fairly well understood, and then COVID really opened up the opportunity for it to be used in a much more specific and helpful way, and now the door is wide open for all kinds of other applications of it. So I was really excited to see the change in attitude towards the whole mRNA opportunity. So that's the one I would pick.
Awesome. Amir, you have to only pick one.
So I think I always get excited with new things, but I guess cancer immunotherapy is the one I'm pretty excited, the way that they are manipulating immune cells within the complex tissue tumor microenvironment to really tackle the challenge of just killing the cancer cells but not really killing other cells. That has been significantly impactful in the society, and we see for some type of cancer is pretty much working. But now we do see more of this diagnostic would be added to cancer immunotherapy, because we have to monitor what's going on, and a lot more advanced nanoparticle and fluorescent type of nanoparticle that actually evaluating performance of cancer immunotherapy. So it means that diagnostic is everywhere. Even in all the therapeutics and treatment, we have to embed this basically diagnostic, which is going to be more prognostic to monitor the performance of therapy.
Yeah, and I would agree with all three of the speakers. So I can pick 5 or 6 areas that would be those. And I think that there needs to be technologies, like you mentioned, tools and technologies to enable all of those discoveries. So understanding mRNA and using mRNA, you need those tools and technologies. Same with the diagnostics. So why do you think it's important for us to continue developing? So we got an up-the-nose test now for COVID. Why should we keep doing more developments on these types of things? I don't know, who wants to take that first?
It's improving the time for diagnosis, for care. It improves the costs in the health system. It transforms the care pathway, so the more we can introduce advanced technology in the care pathway, the quicker we'll really respond to the population needs. Will ease the demands in the hospitals by doing that, having a better flow of the patients, treatment decisions made quicker, providers having more time to spend with the patients and not with the documentation, in the end, patients more satisfied for the care that they receive. So it's definitely a need for the integration of more technology in the care pathways.
Phew. We need more technology. That's a good thing for us. Jeff?
Good for me too.
Yeah.
I mean, it's sort of the obvious is that we have a demographic issue. We got an aging population. We've got more and more people who need the care and less people to give it. So I think there is a impending and already existing imbalance between the sort of the capacity of the system and the demands of the population. We see that in, manifesting as long lineups or what have you. But I think there's a real opportunity. I think in terms of transformations, and I think incremental change to me is fine. But what I really like is those kind of inflection points in history when we can really make a massive difference, a massive transformation in our ability to do something. And so in this case, it's delivering healthcare and delivering positive health outcomes in all kinds of ways at a much diminished cost, or using the existing capacity to massively change the ability for that system to deliver outcomes. So that's what I'm excited about. I'm excited about the idea of diagnostics playing a role in that. I think that there's lots of places where this transformation needs to happen. Diagnostics is a place where I think that we can have a good impact, a really solid, significant impact on the cost of delivery. If we can push a lot of the diagnostics further up the chain, then I think that gives us an opportunity to alleviate some of the downstream weight on the system.
Thanks. Amir, anything?
Yeah, so I guess prevention is, I think, the one that definitely has impact. So the early diagnostic of devices, early diagnostic of different diseases, it does need better technology. We need to detect most of the diseases in much earlier stages than what is happening now in the later stages. That would definitely help to have less costs on the health system, better outcome on the patient side. But many of this technology, as you see, they are actually designed to be used in the hospital and in the family physician also, in these kind of settings, and used by professionals. So we need to do a lot of work, as mentioned by Danny, and the errors on the use of the devices. There are lots of solutions for that. So we have more integration of electronic to monitor any potential risk of error coming from this technology. They can be identified and embedded in the device. Then we got to be able to actually have more human performance factor come into play to be able to translate them in home testing. So many of them, again, if you're going to use them in actual home settings, we have to consider this factor. They definitely need more development in that sense. But as well as basically a lot of these drugs, it takes years and years to be approved. So there's a concept like miniaturized clinical trial. So we would be able to actually hand over the devices to people in home. That rather than having only 100 patients to be monitored to get the drug approved with 200 patients, you can have 10,000 people all around the world with different demographic factor to be considered in a clinical trial. So that is definitely a diagnostic. So we need to be coming to play to have chance of doing miniaturized clinical trial, reducing timeline from many years to 1 year or 2 years. Then would be more and more drug coming to play, which was not the case at the moment.
So heard a lot about different technologies and the impact on healthcare, probably our economy as well. But I'm wondering, how does Canada compare to other countries in terms of kind of biomedical technologies and advancements in healthcare? Who wants to?
So
Danielle?
I'll start.
Sure.
So in doing a review, I looked at the top 10 biomedical technology countries in the world. So Canada is in the top 10. It's number 6. So I think we are in a very good place from this perspective. And there is so much more potential because it was calculated that it would grow 8.3% until 2027 from 2023. So I think there is a lot of potential in further expanding and presenting Canada in the top 3. Why not?
Why not? Awesome. Jeff?
Absolutely. I think that we definitely should be shooting for that. I remember when COVID came out and I was like, oh, okay, well, I wonder when we're going to get our vaccine. And then the news came out that Canada didn't have a vaccine creation capability. And I was shocked. I was like, really? We're Canada. How can that be that we don't have the ability to create the vaccines we need? And so to their credit, the government realized this as well and said, okay, we need to do something about this. And now we're now pursuing the programs together with Amir. We're just a small part of this, but there's a big program out there for Canada to go and address that. So I think that's fabulous. I think we also need to encourage the entrepreneurs and encourage the folks who are going to go out there and create the new big Canadian opportunities. And I think that's one thing that Gene Biomedical is very excited about is, enabling that entrepreneur to realize some big things. So I think Canada needs to support those entrepreneurs. We need to pull up our bootstraps and actually take some risks as individuals, young individuals out there who are have a great idea, see an opportunity. I think we need to support them, but I think those people also need to jump in with both feet.
Thanks, Jeff. Amir?
Yeah, so in terms of innovation in it, design technology development, definitely Canada has been one of the pioneers in this area. There are a lot of funding support to really leverage this technology in different stages to some extent. I can talk about a lot of challenges later on, but in terms of the stages that we have seen more support last couple of years to really have more manufacturing of these medical devices and implement them in different clinical settings. And then more international collaboration, because majority of these disease management type of scenarios they basically need more international collaboration. That Canada has been pretty good of establishing more national, international initiative that are to really match large funding to support collaboration to tackle the challenge of bringing all the expertise on board to be able to develop this technology platform. But it definitely need more and more, and definitely discuss about that.
Great, and I'm looking at the last two questions I have, and they will take longer than the time that we have allotted. So I'm gonna see if we can get some questions from the audience now. And I think Joe might have sent me one online. Or do you want to start? Let's start with one in the room here, right at the front.
Listen to George Church of Ireland coverage.
Oh, we're gonna get a microphone to you, I think. Yeah, just so the people online can hear.
We listen to George Church of Harvard and companies like Nebula. We sure will get our entire genome sequenced at 100x. And I guarantee you, if we all did it, we find weird stuff, right? There would be SMPs out there that we don't know what they're for. Do you think there's a risk of overdiagnosis as you hand this kind of technology into the hands of consumers?
Who wants to go first?
You go ahead, Aaron.
I can, yeah, absolutely. It's a good question. So, one of the issues with the gene sequence is even you detect a change, mutation in the genes, what you got to do with that, right? So we do see a lot of services from health system and other labs that they actually do this kind of provide these services for the patient. But nothing that clinician can actually do with that quite easily. So that's going to increase the risk and stress to the patient, how to manage those kind of conditions. But I guess the value usually comes if that kind of technology embedded within a good clinical trial to develop a certain biomarker or the strategy to manage the disease. So it does need to be AI come to play and then basically develop all the technology platform to address the needs in certain population. And we do see more and more clinical trial, more stratifying the patient for certain disease, not just going to be one solution for one mutation on everyone. So we have to have more and more clinical trial, and this technology would be embedded within the clinical trial to be able to address the needs. But absolutely, it does impact the patient if there's no solution for that. So it should be definitely considered.
Yeah, I think it's a really interesting point. Overdiagnosis is, there's a lot of people out there who would love to know that there's something wrong with them because they like to know, they like to have something wrong with them. No, but I'm a hypochondriac, so I can say that. But I think it's important not to blind ourselves to the information that's available. And if we say that we don't want to know about the millions of different gene sequences and all the weird things we might find in them, I think we're all missing opportunities for some benefit. It's a transformative benefit, things that we don't even know about now, some relationships between certain kinds of mutations or whatever it happens to be. So I think it's important not to be blind, not to be afraid of the information. Get the information, manage the hypochondriacs like me, but don't be afraid to get the data, and share the data widely so that we can all benefit from it.
You share your genome?
I don't. I don't go to 32 because I don't trust the companies yet. So yes, there needs to be regulatory stuff around that as well for the protection of privacy. Absolutely.
Yeah, and I think trust has to be built whenever all these new technologies are brought in the system and used by the public, and initially used as a complement to the traditional type of interpretation and diagnosis and prevention, until it's proven that it brings the value that it's supposed to.
I would agree. That's a great question. We have one online, and I think there was a lot of emphasis on diagnostics today here, but that is only half of the recipe for improved health outcomes. The other half is interventions that address the detected problem. Thinking especially about remote and marginalized communities, can the panelists comment on the prospects for advancing the delivery of interventions? Do you want to start?
It's yes, it has to be a design, a co-design, a complex one where you have to look at what's available from infrastructure perspective and what type of services can function there, both for detection and prevention. And it would definitely be a blended intervention of how that can function, mobile clinics, all kind of ideas that can support remote areas with treatment and care.
Jeff or Amir, yeah?
Yeah, it seems to me that a lot of the technology exists. There's a few pieces missing. There's a cultural piece that was only recently resolved, and that is in sample collection. I think sample collection is a place where care needs to be taken because it will have an impact on the accuracy. But I think other than that, we have the internet. We have now AI. I think could make a big difference in the ability for the capacity of the system again to serve those remote communities as well as the urban ones. So it seems to me that there is a puzzle we just need to put together. We have all the pieces, or most of them, and the ones that we don't have are coming along with the help of folks like Amir and researchers all over the world. So I think it's really a matter of will and a bunch of people sitting down, scratching their heads, and creating a delivery system based on the pieces we know that we have.
I think there are some innovation going on in terms of improving the intervention in different clinical settings. One of them that is pretty exciting these days, as you would be able to actually, our company has a problem of getting consent from the patient because you give the neurodegenerative disease condition, you give the medication to the patient, but they don't know how effective it is. There's a lot of side effects and they have no idea whether they actually have to use it or not. Even they are pretending that they are using the drug, but they are not because of a lot of side effects. So if you are able to give them a consent by just providing more information to them, and then maybe that kind of person can compare themselves with someone else in another part of the world with the same condition that you have, same age, same family history, and so on, then you will see that the drug has been effective for someone else similar to you, and then you're going to get consent to use that drug, and then that would be better performance on the way that people or companies actually manage intervention for the patient. And it is now getting practiced as it's aligned with the concept, as I mentioned, more miniaturized clinical trial. And they are going to have more people all around. The data would be accessible to everyone. They can see what is the effect of that drug for certain different condition. That's going to be revolutionizing the intervention, I believe, but that definitely have a lot of risk associated with how to manage a patient and what kind of data can be publicly available.
Awesome. I think that leads to another question online, and then we'll do an in-person one. Because the question online was while collecting and sharing all this information is exciting from a healthcare perspective, also some drawbacks. How do you protect that information? Is there a way to safeguard it from cyber attacks and things like that? Maybe I'll go with Jeff to start that one.
Yeah, it's a really difficult problem to solve. We have the tools. Again, we have the pieces of the puzzle, encryption and things like that, encryption and tokenization of data. But it's still very difficult, and I think that the security industry has to pull up its boots and help with that. I still am, as a technology guy, I'm still very concerned about the threat of my data being used to do bad things to me, both from a kind of a nefarious actor perspective, but also from a corporate perspective. I think that the world seems to be moving towards a less regulated environment, and I disagree with that. I think that regulation is an important part of civil society, and so I like I said before, I'm very cautious with my own data. So I think this is a really difficult problem to solve. I don't think we're all that close to solving it in a sort of fully secure way, but yeah, like I say, it's a hard problem to solve. I don't think we solved it yet. The security folks need to help out and come to some final conclusions. And then there's the regulatory aspects as well.
Any of the other panelists want to add anything, or?
I think it's also about the model we are looking at. Now we have custodians of our data, but what if we flip to the model of us being the custodians of our data, and you provide the data for the purpose that you provide it for? So there is also discussion about different models of how we deal with this, and then regulations would change, policies and such. So that's an important aspect too.
Still in the works. Amir, anything to add for that one, or no?
No, if Jeff doesn't have any solution.
Yeah, then we don't. I think we had a question in the room.
Hi there. In your opinions, what do you feel are the next steps towards advancing new or incoming medical technologies?
Amir, do you want to start with that one?
Yeah, I mean, technology is there. It just matter of it's not implemented to me. So there are a lot of technology are coming through invention are there, but the most challenge, particularly in Canada, we have is basically what going to do after making prototype, right? You have to do preclinical evaluation, establish a quality control, doing clinical evaluation, human performance factor implementation, utilization, implementation, adoption. There's so many steps need to be done to be having that technology be there in the right position. And it's not just actually the task of inventor to be taking care of all these things. It has to be identified on technology platforms, I would say, not just technology devices. So platform need to be identified by the governments and whoever is responsible. And then they kind of helping to manage the technology platform to move all these a step forward. And then there will be more innovation going to be added to that. So we do see that they're going to be just stopped by it at some point because they are not able to translate it because of lack of money, lack of support. Being in this environment that is extremely competitive, big companies are taking over a lot of invention, maybe shutting down a lot of invention as well. And then these are the challenge we are facing is not, we do have a lot of good engineers design so many good things, but who's going to translate them? Transformation, which is part of the a big part of the transformation is manufacturing, which we do see they really lack in Canada. So we have to develop things, eventually have to license it back to someone in other countries to manufacture, but we have to have more manufacturing. Even manufacturing is needed for validation. It's not just after just hand it over to the patient. We need 10,000, 20,000 devices to be made to be reliably, to be actually validated based on regulatory of Canada FDA. But how are we going to make those 10,000, 20,000 devices without having good manufacturing facility? So that would be, these are the hardest we are facing. I think that's not innovation challenge, it's more implementation and transformation.
I thank you for talking all about the things that we're trying to do. So that's exactly right. Like there needs to be. I have this vision of or this hypothesis that there's a lot of Canadian intellectual property that is getting undervalued to the people who are creating the intellectual property, And if it can enable a made in Canada approach where we take the R&D in Canada, it's that raw material, and not export it as a raw material, but export it as the full value add. So enabling the additional intellectual property that's required to manufacture something, and then doing the prototyping, and then finding the markets. I mean, this is all something that Canada can do, and that's something certainly that we're trying to support.
And from the boots on the ground in healthcare, I think advancing would mean to really test in the system whatever was developed, measure it and see what the impact is. So it's adoption, integration, interoperability. So those are key elements to really advance it in the system, implement and really be used by the public and providers.
So I think I'm hearing lots of communication and partnerships, not just academia invent things, but also industry, but also the healthcare system, regulatory, everything has to happen together. I think there was one other question in the room here.
Thanks. What I'm interested in your opinion is, I noticed you're sponsored by an insurance company this morning, and they love to collect lots of data and use it usually against the consumer. So I'd be very interested in your thoughts on that privacy protection and some of the ethics and policy that you're going to need as we start developing more and more ways of tracking every last little thing, as they already are doing in the auto industry, as one example.
Okay.
Go
Can
ahead.
I start? So that's top priority for every innovation trial that we do when we have to work with data. There are multiple steps from security perspective, legal, ethics that we have to follow. We have to explain how data flows, where it goes. When we extract data from, the systems have to be de-identified. And also, even with that, with machine learning and artificial intelligence, we have to be sure that there are no ways to be identified back. So really looking at all these aspects, but also providing guidance to the policy developers, the ones that have can change the Health Information Act and others, of what needs to be addressed when we have new technologies like AIML coming and we don't have the legislation to cover it. So there are aspects that we work on. But for now, everything is super checked.
And so we have a question online as well, kind of related to that. Whether it's political or personal perspectives, trust has been mentioned as a major hurdle, especially after the pandemic. Some people don't trust facts. Some people don't trust government, don't trust healthcare. What needs to happen to get the conversation going in a positive direction again, so we actually can see some of these technologies, in use?
Being part of the experiments, of the innovation trials, because they are built in the healthcare system, being part of that and being exposed to what the results mean and transparency of the results of all these innovation trials, I think it make a difference in that. Plus, being part of those innovation trials would change their behavior and mindset, which is a very important thing across all the advancing of technology. It's the mindset and the innovation culture.
And I think
literacy.
Co-developing technologies with the end users.
With the patient, with the patient in mind. We have patients involved in every innovation trial as advisors as well.
Yeah, that's good. Jeff?
This is another one of those hard problems. Reestablishing the validity of science is something I didn't think we would have to do. But I think we're in that situation now, and I don't have an answer on how to resolve it. I think rebuilding trust is key. I don't know how to do that though.
Amir?
It's a really hard problem. What do you got, Amir? Because I got nothing on that.
I think that's definitely part of the issue. So when the new, emerging technology coming from innovator, they actually get very quickly publicly exposed, and then public can get an impression that this is actually the one going to change a life. But from that stage to the stage that's going to be regulatory approved, tested for 10,000 people, and then get all the data back, that's going to take a couple of more years. But we do see that news is all around, and people say, oh, this is the one coming through, already impacted, but that's not the reliable one. We have to wait for a couple of years. And we don't have any system to actually show what is the stage of that technology next year or next 2 years or 3 years. So we're just going to hear the news right at the beginning, and we don't know what happened to that technology after that. So that kind of news is impacting already public, the trust, as you mentioned. And I think we have to definitely establish a system to monitor or track a kind of stage of technology. But if you read the document that come from FDA or other regulatory agencies, there are tens of thousands of tests has been done for that device, but all different type of people and all the condition has been tested. At that scenario, then you can start getting the trust as soon as this kind of document get accessible or change to more kind of visual way people can understand those kind of data. That would be then trust going to be coming to play.
Mm-hmm. Yeah, I like that. I think we have another question in the room here.
Hi, can you speak to technology advancements in nutrition, particularly the identification of deficiencies and how that could play into self-care?
Nutrition?
Nutrition. So there are multiple ways in which we address that one. In Alberta Health Services, we have a provincial nutrition services body that is creating resources for population to know how to deal with chronic diseases, and for each disease, what type of nutrition is required. So there are definitely resources that support the public to do that. I think it's more about working with the public, more intensive to use the tools that would support them in how to monitor, how to build their nutrition daily intake and such. So there are multiple tools also in My Health Alberta for the public for that.
Jeff?
I think this is the topic is, if you want to address it at a technical level, Amir is your guy to answer, and Daniela. But I think we have tools now at our disposal that we didn't used to have. So self-monitoring applications, even self-monitoring diagnostic tools. When I was at Verily, we were developing a watch that you would wear, but there are other diagnostic tools I think that we can use and leverage to get a better understanding of that, and then share that with practitioners, with our GPs, for example, through applications. So I think that, again, there's some puzzle pieces that are there. They just need to be put together in the right way.
Yeah, I mean, I think from the innovation side, lots are being happening now. The way that these nutrition are delivered through different delivery mechanism, how to keep them in longer term in the body, and they're not going to be basically discharged from the body itself, and how to deliver those kind of nutrition in more profile release manner. So you're going to have a certain pattern of delivery during the day, not just constant concentration in the body, but as well as having like more these variables, as I mentioned, coming through the action, like monitoring your sweat condition, or taking sample from saliva to not only see the concentration of the nutrition in the body as well. Basically, you're going to be detecting what is the impact of that nutrition on your glucose concentration and any other factors. So these are not more multiplex biosensors coming to play that detect the nutrition itself as well as impact of nutrition on the different biomarker. So these are lot of research is doing on this area, but translation again, dealing with the regulatory things coming through. Definitely less regulation challenge for nutrition rather than drug. So we do see people try to see how they can bypass regulation in that sense.
So I think nutrition is a good place to end, because I see fruit left on the table in the back. So everybody's got to go finish that fruit before you leave. I'd really like to thank our panelists for coming here today and a great discussion. We probably could have had another couple hours, but we've got a limited time. And I'll hand it back to Bill.
Thank you, Mike, and thank you to our panelists.
Good job, Brad. Well done.
And of course, thank you for attending today, both in person and online. The connection that we have in the community just amplifies the impact that we are able to achieve at the University of Calgary and certainly in the Schulich School of Engineering. And so engagements like this are so important to us. There were some questions asked around security and privacy of data. And so very timely on that is our October Schulich Connects is going to look at cybersecurity and privacy. And so I hope everyone is able to join us for that event. Until then, have a great rest of your day, and I look forward to seeing you at our next event. Thank you.
Thanks for tuning in to this Schulich Connects, proudly sponsored by TD Insurance. We'll see you next time.